Hello, it's back to school season, and everyone is checking the backpacks, lunch boxes, school uniforms. But what about the eyes? Do we need to be having eye checks for children coming back to school? That's what we're here to talk about. We are members of the Pediatric Ophthalmology section of Cleveland Clinic Abu Dhabi. My name is Arif Khan. I'm section head of Pediatric Ophthalmology and a pediatric ophthalmologist myself. Ophthalmologists are surgeons who do medical and surgical care for eye disease. With me, I'm very happy to have two of my colleagues. To my right, Dr. Andrew Malem, who is a consultant pediatric ophthalmologist in the section of pediatric ophthalmology. And to my left, Zabila Khan, who is lead orthoptist in our division. An orthoptist is a healthcare provider who is a specialist in children's eye problems, and also in eye movement abnormalities. Thank you both for being here.
Thank you.
So I'd like to start our conversation with Zabila.
Okay.
So Zabila, it's obvious that if a child has a problem with their vision, they should have an eye exam. But what about children who are not complaining? Does a child who's a school-aged child need an eye exam?
Absolutely. Actually, most children don't actually complain of vision problems, even when they do have an eye problem. And that can be for a number of reasons, but one of the reasons is that they can have an eye problem in one eye. So they have one good eye that compensates, so they never actually complain. So yes, all children should have an eye exam, even if they're not complaining.
So are there any behaviors that children might express other than having a difficulty in their vision that are a sign of a need for glasses?
Yes. There are some that are quite obvious, of course, squinting the eyes when they're trying to see something, holding things close to their face, excessive blinking and rubbing. These can be quite obvious signs. However, sometimes these signs are not so obvious, and you can have children that have an abnormal head position, for example. So they'll hold their head in a certain way, so they may chin depress, or they may tilt their head or turn their face. And they do that as a compensatory mechanism or to see better. So yeah, there are some behaviors that children do exhibit that show that they may have a problem. And again, some of these are quite obvious, but some of them are not so obvious. So parents should really be aware of all of these.
Yeah, and I'll add to that, sometimes we've had patients who are diagnosed with developmental delay or autism who, when we examine them, we find they have high refractive errors, that is high need for glasses, and when they get that correction, their behavior completely changes. So sometimes behavioral issues are related to eye problems.
Absolutely.
So, related to what you've been saying, it's not uncommon for there to be screening in pediatric offices, in schools. If a child passes the screening exam, does that mean that everything is fine? If they're still complaining even though they passed the screening, is that just the child not behaving?
I think it's important to understand that screening is still screening, and there are limitations with it. It's not a comprehensive eye exam. It's not, gold standard for children is to have a dilated eye exam, which is by dilated I mean putting eye drops into the eyes. We open the pupils, able to look at the structures of the eyes very well. So all children should have a dilated exam. Screening has its limitations, but it is very beneficial in some ways.
Okay, thank you. So now I want to move over to Dr. Malem. Andrew, thanks for coming. We live in a digital age now, and more we're looking at screens, and at an earlier and earlier age. So what implications does this have for children's eyes, and what are the consequences of this?
Yeah, it's an important question because it's probably the most common question I get asked by parents. Even today, they ask. Some of it comes from all the press we hear, and some of it is a little bit of guilt because screens are everywhere now, and they're integrated into education, they're integrated into entertainment at home, they're integrated into communication. So we do need to know, well, what is this doing to the eye? Is it causing any harm? And is that harm long-term or short-term? And I think there's been an enormous amount of data since the sort of digital revolution. And what we can see is that there's sort of short-term effects from kids using a lot of screen time. And then there's the slightly more concerning longer-term implications. And I think the short-term things are things we've probably all experienced, which is, when you're staring at a screen, you don't blink as much, your eyes get dry. That's all very common. Kids have better tear films than us, but when they're really stressed by using a lot of screen time, even they can get dry eyes. And the other things, if you're really focusing at a near screen or a near point, or even above for a prolonged period of time, that can put a bit of strain on the visual system, and some kids complain of headaches, or get a bit of intermittent blurring, especially if there's any underlying binocular abnormalities. And they're all pretty much short-term, where you stop and things get a bit easier, or you reduce the screen use and things get easier. What's more concerning is that what we're realizing and what we're seeing around the world is that the more time kids spend indoors doing near activities, whether that's, in reality for most people that's screen time, the more we're seeing it's actually affecting the way the eye develops. And all children's eyes grow. That's part of normal physiology, like we get taller. But what happens when you're looking at objects that are near for really prolonged periods of time in those crucial years is it seems to accelerate the normal rate of growth. And that means that the eyes become myopic, and that's effectively when near vision is okay, but when you look in the distance, things get blurry. And that's important because myopia later on in life is one of the risk factors for visual problems, including retinal issues, glaucoma, certain types of cataract. And the higher the myopia, the higher the risk of these issues later on in life. And what we know is that a lot of screen time at very young ages tends to increase the risk of getting myopia at a much younger age. And that leads to higher levels of myopia at the end, which increases your risk. So we almost need to think of myopia in a way as like a risk factor for a disease, any other disease, like blood pressure is for cardiovascular disease. Myopia is one of those risk factors for visual impairment. And so a big part of that is the environmental change that's occurred from being outside to spending a lot of time indoors, and indoors on near activities like screens. So it's an important issue, actually.
So sometimes, I hear parents say that, myopia isn't an inconvenience, but later on they can just have refractive surgery and then get rid of the glasses. So what's the big deal?
Yeah, and that's a common thing I hear as well. So there's a few issues, I think, with that. The first is it's not uncommon for kids who have been given glasses for them to break, and then they end up not wearing any glasses at school for 6 months. And so, and then the vision at the board is very blurred, and it impairs their learning. So while you have myopia, you're not always fully corrected anyway, and so you're sometimes living in an environment which is suboptimal. That's why you have it. It's true, some people when they're adults can have laser refractive surgery, but there's two elements to that. One, it doesn't change the actual structure that's occurred in terms of how long the eyes become, and that's the real risk factor for other retinal problems, glaucoma, those sorts of things later on in life. And in fact, the more kids develop myopia at a younger and younger age, the higher their end number tends to be, and there are limits to refractive surgery. So not all kids, when they grow up, can have refractive surgery, and so it's very important to try and delay the onset as much as we can by changing our behaviours and reducing screen time and getting outdoors, getting natural light exposure. So it's a common question, but it's not quite that simple. It doesn't change the overall risk for those issues that we talked about later on in life.
Absolutely. And I think part of the problem now is in the schools as well, the screens are being encouraged. They're just easier. It's hard to go back from that.
Yeah.
In Southeast Asia, the public health system has taken a more active role in limiting the screens, making outdoor time mandatory, setting the distance between the screen and the student. But we're really lagging behind in the rest of the world. What can we do about this? I mean,
yeah, it's very true, and I think the sort of Southeast Asian explosion of myopia has been that warning for the rest of the world that are earlier on in the curve, and we need to learn from those countries, because sometimes things that creep in slowly and the prevalence of myopia creeping up slowly, you take it for granted, you think it's not a big issue, but we've seen in Asia and Southeast Asia how important it's become, and now they're trying to backtrack and trying to recover the next generation so they don't develop the same issues. So I think we have to learn from them, and I think that small behavioural changes can have big impacts when it's done on a population-based scale. So simple as things, getting outside for 2 hours a day is really important. If you can push that to 3 hours or 4 hours, that's even better. There's a sort of dose response curve in terms of spending time outside and how important that is in reducing the incidence of myopia. And there is some data emerging even on how much that myopia progresses, can be improved by spending time away from the books and the near focus, the screens, and getting outside. So we have to learn from them, and we can't take it for granted that just because at the moment the prevalence is lower here, that it's not an issue. These are lifelong changes, and for the individual and population-based level, it's important to act early while we have while we're fortunate enough to be earlier on in the curve, really.
another thing that I've seen, and I'm sure you've seen it as well, is sometimes children who are excessively looking at these near devices, sometimes their eyes actually get stuck inward. Mm-hmm. Obviously, when we look at near, our eyes have to turn inward to look both at the same object, and then when we look in the distance, they're supposed to straighten. Sometimes they actually get stuck with, so it's so multifaceted.
Exactly, that's it. And we've seen a few cases of that here at Cleveland, especially those teenagers who are really into their gaming, those sorts of stay up all night, 6-8 hours of prolonged gaming, those things. So it's not just the myopia, it affects our overall binocular control. And in those patients that are susceptible to that, it can decompensate, like you say, into a full-blown turning in of the eye, and often these may need an intervention or surgical procedure to re-straighten.
Zabila, I wanted to, because I know you have some experience with this in terms of behavior. You were concerned about what was happening in a certain school, and you actually took the lead to educate the school administration about the problems of screen. I think one of the problems was difficult getting the message to the right people. And actually that changed something. What can you tell us about that experience?
Yeah, so I did some outreach with local schools here in Abu Dhabi. And the main reason for that was firstly to educate people on the importance of vision screening in children. Because what I found was it was so variable what different schools were doing. Not all children were having eye exams when they were supposed to, and at the right age. So, and building on that, I also explained the importance of really having children outdoors as much as possible, promoting outdoor reading and reducing screen times as much as possible. And one of the schools that I work with, British school, Al Khubeirat, they were very receptive, and as a result they opened an outdoor library just to encourage children to be outdoors when they're reading, and the response was phenomenal. Parents loved it, the children loved it, especially in the winter months here. They're all outdoors reading, and that's just fantastic. I think it's really important for people to know, as Andrew said, that children need to be outdoors. And if we have schools on board, that's half the battle.
Yeah. And when we're saying outdoors, it doesn't necessarily mean to be out and in the sun, but to getting the light from outside, even under shade outside, is a big difference from being in a room that's illuminated by artificial light.
Yeah. And
Absolutely.
even wearing sunglasses, like you say, they still get that benefit. There's such a difference in the luminosity from outside and inside. And it's one of the magic things about our visual system, that we can adapt and function in these hugely varying levels of light intensity. But being outside, like you say, even in the shade or even in sunglasses with a hat, all those things, it still has beneficial effects. And the more we learn about it, the more we realize that it's probably even more complex, the benefits of being outside, than just the light. It's probably even the spectral scene, the contrast, the images that we're seeing. They're very different to what we see on a screen or in a book. And the visual system has developed to be outside, and it's quite artificial spending hours a day, looking at this near object that we've created. And so as we learn more and research more, all we're finding is more and more reasons to be outside, and having breaks from the near activities.
I think originally, historically, we were all outside and looking in the distance and occasionally looking at near.
Yeah.
And now it's completely flipped.
Exactly.
We're inside most of the time, looking at near most of the time. And this is having consequences, especially in children who are very susceptible to the environment.
Exactly.
One final point I wanted to cover. We have been talking about school-aged children and the importance of an eye exam in school-aged children. But as an orthoptist, I think it's most appropriate to ask you, Zabila, at what age should a child have a first eye exam, and who should be doing that exam?
Yeah, this is a good question. I would say we actually recommend that all children have an eye exam by the age of approximately 4. This is because there are certain eye conditions that if you treat after that age, the outcomes can be significantly different. So all children should have an eye exam by the age of 4, ideally with a pediatric ophthalmologist. And I say that just because it's a comprehensive eye exam, it's a dilated eye exam. As I said before, we're able to look at the structures of the eyes and make sure everything is normal. Screening is great, but it just doesn't give you the same level of information and detail that we need to really be sure that children are seeing well.
So now if a parent feels that an infant or a young child has an eye problem they don't seem to be seeing, or their eye seems to be turned, do they need to wait until the child is 4 years old for the exam? Is it possible to examine these children younger? How can their vision be assessed if they're pre-verbal?
Yeah, so all children should be assessed immediately if parents notice any issues. And that's a great question, because many parents will come in and they say, I was wondering how you were going to examine him because they don't speak. But we are able to examine children even if they are not able to yet communicate with us. And we do this mainly objectively. And we watch their visual responses, and we're able to look inside the eyes, again with a dilated eye exam, and make sure that they're seeing well. So there is no age limit on eye examinations for children.
Well, I'd like to thank both of you for being here for this discussion. I'd like to conclude with 2 statements from each of you. One, what is a popular misconception that you hear, because you both see a lot of parents, a lot of families, a repeated misconception that you hear about vision? And the other is one message that you'd like to give from this podcast. Go ahead, Andrew.
I would say, I think a common misconception I hear quite a lot is that there are these things called blue light filter glasses, and there's a lot of marketing and press about them, that they have really quite magical effects on our visual function, how well we see, our eye strain from using devices, our sleep, even our retinal health, and the reality is that although there's been a lot of studies trying to look at them, most of these studies have not been very good, And the summary, the outcome is that there isn't really at this point any strong evidence that they offer any significant benefit. And I think the concern I have with them, and sometimes I even have parents coming in just asking for glasses just so they can wear these glasses, is that it makes you feel that you can just use your screen as much as you want because you're somehow protected by this special filter. And the reality is it definitely doesn't have an impact from what we've seen in the data on myopia and all those other things that we've heard about. And more data is needed, but I wouldn't want parents feeling that if their child is wearing these blue filters, that they're somehow protected from the negative impacts of excessive screen use and all the things we've discussed so far. So at the moment, what I tell parents is there's a big review of it in 2023 called a Cochrane review, a very sort of special review of the literature. And from that, there wasn't really enough evidence to recommend them. And so you're better off just having breaks from the screen and not using it before bed as if you want the benefits.
And actually, just a corollary to that, there's much, much more blue light coming from the sky outside when you're outside than the blue light from a screen. So
Exactly.
if it was really true, everybody should be wearing them all the time.
Yeah.
That's just...
Exactly. And I suppose one message, I think I'd just reiterate what we say, which is, we can't avoid screens completely. We know, that's just not practical in life nowadays. But minimizing it, especially when you're very young, under 4, is really important, trying to minimize it. And if you can keep it to less than an hour a day, that's great. But if you are using it longer, having a break after 30 minutes and go outside, and if you can hit 2 hours outside, then you're doing yourself a lot of favors. Yeah.
Thanks.
So I would say one of the common misconceptions that parents come to me about is that wearing glasses is going to make their child dependent on the glasses and weaken their vision. And this is actually very far from the truth. And children that have vision problems, say amblyopia, if they do not wear their glasses, their vision does not develop normally. So it's really important that parents understand that it's detrimental to a child's vision not to have those glasses in that case. So that's a misconception for sure. And I would say a take-home message is all children should have an eye exam by the age of 4 or immediately as soon as a problem is noted.
Well, thank you both. This has been a great conversation.
Thank you.
And everyone have a great school year. Thank you.